Welcome to the My House Podcast, a show about the past, present, and future goings-on at the My House Youth Drop-In Center in Wasilla, Alaska, with your host, Michelle Overstreet. Hello, welcome to episode 63 of the My House Podcast. I am not Michelle Overstreet, but I am Isaac Smolden, and today I am joined by Dr. Kira England.
Hey,
and
Isaac.
I have been given permission to call you Kira, so I don't have to say Dr. England every time. But you worked very hard for that doctorate, and we do need to acknowledge it off the top of the show. So, Kira, how's it going this afternoon?
It's going great. Thank you so much for having me.
Yes, this is just another way, another offshoot of the beautiful partnership between public health and My House. And I think long before either of us were working at our respective positions in the early days of this building over a decade ago, there were public health nurses who were staffed in this building multiple days throughout the week. And we still have a really great relationship with public health and with the Department of Health, because it is so important for our clients to be able to access those base level services, pregnancy tests, STD, or should I say STI? STI checks.
Yeah.
Thank you for keeping me honest. And all of those kind of, bottom of Maslow's hierarchy, right? Base level needs. And anytime we contact public health nurses, they always get our clients in as quickly as possible, pretty much always same day, which we really appreciate. So what are we talking about today?
So I am here to talk a little bit about hepatitis C. So hepatitis C is a pretty big problem in Alaska, and it's very strongly associated with drug use, particularly injection drug use, at least in recent decades. So, I would just love to spread some awareness about testing, prevention, where to get treatment, just some of the barriers that are, that exist in our current health and social care system. And also really would just love to highlight some of the ways that My House does things like build community and things like that really just help address health holistically.
Yeah.
So
what brought you to your current position in the first place? Maybe we start there before we dive into the details.
Sure. So I grew up here in Wasilla. I really had a lot of experience from my peers to lived experience with, risk-taking, substance use, things like that. And, after I entered recovery, it really was important to me to help people who are still struggling or, maybe are in recovery but have lingering health issues such as hepatitis C. So after I finished high school, I left the state to attend college. I kind of moved around, trying out different things, started in biology, then went to education, the field of education. But I was just so strongly drawn to the social sciences.
Mm-hmm.
I felt like biology was a really important part of the piece of what we experience in society, but there's just so much more to it. So I went to pursue my PhD at Penn State. I actually just finished in May, so it's been very exciting. And then with that degree, I studied stigma, I studied trends in drug use, and also how the role of medicine in our lives has changed. And, when I saw this job pop up for a syndemic specialist, so I'll tell you a little bit more about the idea of syndemics in a minute. It's a little jargony.
It's pretty 50,000 foot,
Yeah.
what we're talking about right now.
It's definitely jargony, but I do think it's a simple way to condense some ideas. So I'll get to that. But saw this job posting last fall. It was a brand new position. And I was like, wow, that's just so perfect to, have the opportunity to build partnerships to support simultaneously addressing things like high-risk drug use, infectious diseases like hepatitis C, HIV, syphilis, and then social conditions like experiencing homelessness or incarceration. Because when we deal with all these things in isolation, it's way less efficient people aren't getting the health care they need. They're not getting the support they need. So,
and it costs a lot more money too
exactly.
to boot for the state and federal governments that are usually paying and have a vested interest in trying to address those issues.
Exactly.
So tell me about what, and say what it's called again, because I'll butcher it.
Syndemics.
Syndemics.
Yes.
SYNDEMICS.
Yes. So it's like a common.
I can spell.
Good job. Yeah, it's like a combination of the words epidemic and
Synergy.
Synergy.
Yeah.
Yep. Synergistic epidemic. Exactly. So yeah, it's just the idea that there are a lot of health and social conditions that tend to cluster together. And if we just address them in isolation, it's not as efficient.
Mm-hmm.
So for example, like I said, hepatitis C often overlaps with opioid use disorder, infectious diseases, and things like that.
Why is that?
Largely because of what we call healthcare silos. Again, kind of jargony, but healthcare silos is just the idea that most healthcare services and also social services tend to be kind of isolated. They don't tend to coordinate with others.
Mm-hmm.
They don't tend to be particularly comprehensive. You have to go to one place for, your primary care. You have to go to another place if we're talking about hepatitis C, you might have to, get one test in a low barrier location, such as, maybe some place like my house. Then you have to go get a confirmatory test at a health center that offers that kind of things. Then you have to find someone who's willing to treat. And there's just so many different steps. And it really just leads to really poor outcomes in terms of how many people are getting treated for hepatitis C. So some of the things we're doing in public health, in the Division of Public Health, are really working to make it easier, like simplify those steps.
Mm-hmm.
So can definitely talk a little bit more about that.
Yeah, for sure. So, and before we talk about those steps, because, and not just Hep C, but a lot of the things you're mentioning, there's a big overlap with populations that we serve here, and the problem is really exacerbated because of how geographically large our state is, and in the valley, how difficult transportation is to those, spots that you need to go to receive the treatment, how isolated we can sometimes be. So give me kind of a quick rundown of, specifically we're talking about hepatitis C prevention. What causes it? How is it transmitted? What are some big risk factors for it? But then also importantly, how can we treat it?
Right. Great. So hepatitis C is an infection caused basically by the hepatitis C virus. And it is actually the most common bloodborne disease in the United States, and it kills more Americans than any other infectious disease. So I think that's a fact that
crazy
can surprise people. Yeah.
Until it was in the notes that you sent me, you don't think about that as being the number one.
Right. I mean, it's particularly stigmatized, again, because of its association with injection drug use. So I think that's part of the reason why it doesn't receive a lot of attention. But one thing that, a big message we love to get out is that the C in hepatitis C stands for curable. So that, not technically, but that's like the message that it's easy to remember. And it is curable, unlike, for example, hepatitis B, which is a lifelong infection. So it is spread mainly through blood-to-blood contact, again, largely associated with injection drug use, but also just like unsanitary tattoos. It can also be spread sexually, but that's pretty rare.
Mm-hmm.
And it cannot be spread through like casual contact, through like hugging, kissing, sharing food. It's important not to share razors and things like that with like blood contact, but, just like safely giving someone a blood test or something like that is not going to, lead to transmission. So yeah, it's most commonly spread by sharing needles.
Yeah, and for all the social services and peers that are watching this that are out there, this is why we have to do the bloodborne pathogens training every year. This is the big reason why, right? It's so important when we're doing this type of work to be safe anytime that there is blood around.
Yes, definitely. Um, and yeah, it used to be much more commonly associated with blood transfusions. I think they figured out around in the 80s kind of what was going on.
Mm-hmm.
They didn't know what it was at first. They would call it like non-A, non-B hepatitis. They didn't have a name for it.
Then they got really creative and went to that
Yep.
third letter.
Yep. So there are, plenty of older folks who, may have never, engaged in risky behaviors who may actually have hepatitis C. So that's why there's a recommendation that everyone be tested at least once in their lifetime.
Mm-hmm.
But again, these days, that's a little bit less of an issue now that they test for it in blood supply.
Right.
And then when it comes to treating hepatitis C, it's actually incredibly easy, especially compared to how it used to be. It used to be like a really intense medications that were almost like chemotherapy. Like people would be down and out for months.
Wow.
And sometimes it wouldn't even work. Like they'd go through all of this and the therapy wouldn't work. But now, just about a decade ago, there were these new medications introduced called direct-acting antivirals. And it's just one pill a day for 2 to 3 months. And the very, very, very low side effects. Most people don't have any side effects. So it's really just all those steps of, first you get an antibody test that tells if, you maybe have ever had hepatitis C. For about 20% of people, they don't develop a chronic infection. Their body clears it on their own. So that's why you have to go get a confirmatory test where they actually look for like particles of the virus in your blood. And if, that comes back positive, then you can move on to treatment. And it also used to be that treatment was only delivered by like specialists, like liver specialists or gastroenterologists. But now it can be done in primary care very easily. Now, not necessarily all primary care providers are comfortable or necessarily, they may just not be comfortable yet. But, that's another thing that we're trying to do in public health is support clinicians as well. If there are any providers out there who would like to learn more, I can direct you to folks with clinical expertise and all kinds of resources. Because, again, this is something that can be treated in low barrier settings.
Yeah. So it's interesting because the treatment is, it just take it with your breakfast in the morning or something like that. But the steps for identifying and getting the treatment really seem to be where the main sticking point is. Would you agree with that?
Yes, definitely.
So what steps is the state doing and the Department of Health doing to reduce those barriers, and how can people that, are interested in getting tested or that feel like they should be tested, what can they do to start those steps?
Sure. I'll address that first. So the best place, if you do have a primary care provider and you have insurance, go see your primary care provider. That's going to be the best bet. But you can also get testing at the Matsu Public Health Center, for example. And then unfortunately, they do not do treatment yet, but we are hoping to work with them. That's kind of in the process of potentially getting a treatment program going there like we have in Juneau. I can tell you a little bit about that. I also just have a couple other low barrier locations where folks can get tested. So like Matsu Health Services and Sunshine Community Health Center both have sliding fee scales so that, getting an appointment can be a little more affordable and things like that. And yeah, once you get in, they'll take care of you. But again, it can be hard to get there. Another barrier is insurance. If folks don't have insurance, the treatment can be about $30,000-ish.
Oh, wow.
So yeah, but Medicaid covers it very well. We actually have an A+ score. There's a organization that, kind of rates Medicaid policies for all the states.
For the state?
For our state, yeah.
We have an A+ score and a health thing?
Yep.
That is awesome.
Yep.
Look at us.
Yes.
We're making progress.
Yes,
That's
definitely.
great work on you guys.
Yes, the Center for Medicaid Services, like they're amazing for getting that going. And then private insurance usually will cover it as well. But those folks that are kind of in that middle range where they don't qualify for Medicaid because their income is too high, but insurance is still out of reach. That's a struggle, and that's something that we're hoping to find ways to address, whether that's like federal funding potentially. But yeah, that's all in the works.
Yeah.
But then in terms of simplifying people getting access to that testing and treatment, one example is there was a machine that was approved by the FDA about a year ago that gives those confirmatory results within about 45 minutes.
Oh, wow.
So you kind of can cut out that first step of the antibody testing. That's oftentimes just can be like a, kind of like an at-home. It's not technically at home. It would be like in a setting
Right.
that is set up for it. But then you'd still have to do like the blood tests to get the confirmatory. But this machine, you just get the results right away. It's super straightforward. Again, kind of expensive, but we've been working with different partners across the state to get those machines out to different locations. And that really, really cuts down on some of the steps.
Yeah, because then you're just going to one place instead of multiple.
Right. And then, so for example, at the Juneau Public Health Center, we've been partnering with them. And honestly, they did a lot of the work before I started to get this program set up. But, they have the machine there. They have it set up so that they can do treatment as well. So they've successfully treated a couple folks. They still end up having to wait a little bit for lab tests for other things because you do still need some lab tests technically to start treatment. But recommendations have changed from, the medical associations. So even that step, they've recently said you can start treatment right away. Just if those other labs come back not looking good, then you can stop. But just another step they're taking to reduce barriers. So yeah, there's a lot of evidence that the sooner and the faster folks can, get that tested and then the treatment started, the much more successful it'll be.
So what can, as we kind of close, obviously we've identified those high risk factors, and so amplifying recovery, getting people into recovery is an important step. Obviously for anyone that's working, especially in this field, when there does be blood around sometimes, making sure that you're handling that safely, and decreasing those risk factors for yourself, the organization, your coworkers, but then kind of from the more 50,000 foot level, from the syndemics level, what can organizations do to help the community as a whole address this kind of need that we know is in our state?
Yeah, I'm very glad you asked that, because helping folks either enter or stay in recovery is like a huge piece of it, and that's kind of where the syndemics piece come in. If like we're just treating for hepatitis C and then not helping folks with their recovery, it's possible that they could get it again. So reinfection is possible. Ultimately, it's still cheaper to treat, because when, even if someone were to acquire hepatitis C again, there was that period of time where it wasn't being transmitted. Mm-hmm. So, that's really important. But yeah, so we're really working on building pathways for folks to get connected to medications for opioid use disorder. For example, trying to partner with Department of Corrections to help folks get access to those medications. Also working on helping folks get connected to the public health centers when they're released. Working on outreach to people experiencing homelessness to help get them connected to medical care. I also just wanted to highlight the state recently published their guide to medications for addiction treatment. So that's mat.alaska.gov. If you go to that page, it'll direct you to this amazing guide that they just put out that pretty much has something for everyone, whether it's just you're a person who wants to learn a little bit more about substance use disorder and the treatments that are available and the medications that are available. Great information, for folks who are actually like clinicians practicing, or, just someone who, maybe be experiencing a substance use disorder themselves and wants to learn more about their options. Because those are medications for addiction treatment are by far the most effective way to help folks remain in recovery. It reduces the chance of overdose by over 2.5 times less likely to die of an overdose. Extremely evidence-based. So really just keeping that in mind, keeping the fact that recovery is an incredibly important piece of thinking about hepatitis. And another thing I wanted to highlight is there's a lot of research out there that shows that getting treated for hepatitis C, even if someone is not quite in recovery yet, can help that recovery.
Yeah.
It can help with the adoption of a recovery identity, but it also helps just like biologically. So like most people don't really have symptoms of hepatitis C until, much later in life when they start to develop cirrhosis and liver cancer. And also because those effects aren't super strong, early on, it can kind of take a back seat to other priorities. But it does still cause like some low-level depression, anxiety, fatigue. So, there's a lot of research that shows that once folks get treated, those symptoms go away. It helps their recovery. It helps them have increased self-care. It helps them use drugs less, basically.
Yeah.
All that kind of stuff.
Well, and like you said, there's that, that piece, not just biologically, but to highlight that mental piece of if you're addressing this need and taking care of this, then maybe that's the foot in the door to start look at some other, lifestyle decisions or circumstances that you're in right now. And so it's a great kind of gateway for that whole recovery continuum as well.
Right.
And just before we go, to highlight again that collaboration piece of working with organizations, working with DOH, public health, to be able to facilitate clients getting tested, and vice versa, public health, other state agencies like DOC, forming this continuum where either it can go both ways, right? Someone at public health that is getting treatment for hepatitis C can maybe get a referral to, like in the Matsu, and I know this happens with our local public health nurses because they're the best, to, Jeff's Path here at my house if they're 18 to 25, or True North Recovery, or Set Free, or AARS, or, Four Directions. And so there's a two-way referral process that treats things more holistically, and that leads to better outcomes. And like you said, it leads to long-lasting outcomes, because the last thing you want is to go through this treatment and then become reinfected and have to go through it again. So that collaboration piece, very, very important.
Definitely.
Kira, thank you so much for joining us today. We really appreciate you. You were out here a couple months ago, and we appreciate you coming back out and the work that Public Health DOH is doing with and for our clients here at my house. And I think this information is really important and really, really relevant to our recovery continuum out here. So thank you so much.
Thank you so much for having me.
That is all the time we have for today. I'd like to once again thank Kira for being here this afternoon. The My House podcast is recorded in the My House recording studio in Wasilla, Alaska. Our producer and editor is Ozzie Keener. For Michelle Overstreet, I'm Isaac Smolden. Until next time.